Astringent, antiseptic, inorganic compounds. The above clumsy title best describes a group of drugs that vary widely in usefulness and antiseptic power, but possess the common property of healing the inflamed urethra, a property only inadequately expressed by the word astringent. Astringent properties in the chemical sense are claimed for the organic silver compounds, but these exhibit very faint healing power when applied to the urethra. Potassium permanganate. For the irrigation treatment of acute gonorrhea, its virtues are exceeded only by those of the organic silver salts. It is our best remedy to hasten the cure of an active chronic urethritis. It equals nitrate of silver as a preventive of infection when sounds are passed or the prostate rubbed, as well as in the treatment of nonspecific and chronic urethritis. Yet it has its limitations. It achieves the best results when employed in weak 1 to 3,000 to 1 to 8,000 solutions and in large quantity as an irrigation. As an injection for the anterior urethra, it is distinctly inferior to many other drugs. In chronic urethritis that is almost healed, it is inferior to silver nitrate instillation. The statement often made that while gonococci are present in the urethra, silver salts should be employed, and after they have disappeared, permanganate resorted to, is a misleading half-truth. The organic silver salts are, it is true, preeminent as slayers of the gonococcus, but the inorganic silver nitrate and potassium permanganate are useful for all sorts of urethritis, except the most acute, whether gonococci be present or not. Silver nitrate. On the general utility list, silver nitrate stands equal to potassium permanganate. It has not served me well in the abortive treatment, and no one now uses it in advancing acute gonorrhea, except as an instillation for hyperacute posterior urethritis. It is useless for anterior urethral irrigation or injection, but for posterior irrigation, it is as efficient as permanganate. Moreover, for instillation and urethroskopic application, silver nitrate is used almost exclusively. The pain excited by instillations of silver nitrate varies within the widest limits. Many a patient, after receiving one instillation of 1 to 1,000 silver nitrate solution, will never take another. Yet this is the strength at which we usually begin, and some patients grow so accustomed to it that the strength may be increased to as high as 10%. Silver permanganate. This salt is made by adding silver nitrate to potassium permanganate. To 500 cc's of 1 to 8,000 solution of the latter, I usually add from 6 to 10 drops minims of a 10% solution of the former. I have found it useful only as a posterior irrigation in chronic cases, as an alternative for either of its components alone. Mercury oxycyanide. The cyanate or oxycyanide of mercury is highly spoken of by European writers for the treatment of non-gonorrheal urethritis. I have repeatedly tried it and found it relatively irritating and inefficient. The zinc salts. The zinc salts have been little used except as injections for the control of chronic anterior urethral discharges. Yet zinc sulfate in 5% solution makes an adequate bladder irrigation. They rarely cure, but they control the discharge better than any other remedy and are thus of great assistance by the encouragement and sense of cleanliness they impart to the patient, but not, it is to be hoped, to his physician, while giving nature and the more efficacious local treatments time to effect a cure. Zinc sulfate is the most popular of these salts. It is usually employed in a 1% solution or even stronger, though I fancy it is as efficacious in much greater dilution. Zinc acetate is more efficacious. I employ the following formula almost without variation. The combination throws down an insoluble zinc sulfate, which helps to retain the acetate in the urethra. Zinc permanganate is a hygroscopic salt and is, therefore, best kept in solution. At a strength of 1 in 2,000, it is extremely efficacious, sometimes more so than the acetate. It is possible, but apparently unnecessary, to use it in much stronger solution. Other astringents. The following composite preparations are recommended by various authors. Vegetable astringents. The vegetable astringents are legion. Almost every known fluid, from hot and cold water to tea and claret, has been employed in the course of a gonorrhea that terminated in a cure. These remedies are only implied as injections in chronic or non-gonorrheal urethritis as substitutes for the zinc salts. I am not enthusiastic over any of them. The following are advised. Footnote, the, quote, colorless preparation has been shown to be but a dilution of the colored drug. Hydrastis leaves an indelible yellow stain on linen. Ointments and drugs. The application of urethral medication in an oily or greasy form has seemed to many an ideal way of treating chronic urethritis. Results have generally fallen below expectations. I have derived no advantage either from ointments or soluble bougies. Young, who has reviewed the subject exhaustively, employs lanolin as excipient and uses the following formulae. For cases with marked epithelial changes, salicylate acid 0.5 to 1%. For, quote, less severe cases, iodoform 10%, silver nitrate 1 to 2%, or boric acid 10%. For cases with considerable glandular involvement, protergol 2 to 5%, or bichloride of mercury 1 to 10,000, or formaldehyde 1 to 5,000. Janet, Casper, Finger, and Basie are among the other advocates of the method. Formulae similar to the above are made up as suppositories to be inserted into the anterior urethra. I have not found them as useful as injections.